Morning sir, I am AL-FAIZAL Pass. For today's video, I would like to discuss about the pulmonary tuberculosis. Learning objectives. The virus pulmonary infection with regard to cause, clinical manifestation, nursing management, complication, and prevention. When we say the pulmonary tuberculosis, the introduction first is a infection bacterial disease. It's a widespread and many cases fatal disease. It is caused by Mycobacterium tuberculosis, with most common affect the lungs, and is transmitted from person to person by transplant from the throat and the lungs and people with the active respiratory disease. Pulmonary tuberculosis is a bacterial infection spread through the inhaling tiny droplets from the cough, sneezes of the respective person. It mainly affects the lungs, but it can affect by any part of the body, including the tummy, abdomen, glands, bones, and nervous system. When we say the pulmonary tuberculosis is one of the most prevalent infection of human being and contribute the considerable and illness and death around the world. Is spread by the inhaling tiny droplets of saliva from the cough or sneeze of the infected person. It's slowly spreading chronic granulomas bacterial infection characterized by granules weight loss. Yun yung ibig sabihin ng pulmonary tuberculosis. What is pulmonary? This is discussed to you my groupmate Miss Hassan Marcelin.
Assalamualaikum. My name is Marcelin A. Hassan, so I'm going to explain the pulmonary tuberculosis. The learning objective of the pulmonary tuberculosis compare the various pulmonary infections with regards to causes, clinical manifestation, nursing management, complication, and prevention. So, introduction of the pulmonary tuberculosis. Pulmonary TB is a bacterial infection spread through the inhaling tiny droplets from the cough or sneezing of an infected person. It mainly affects the lungs but can affect any parts of the body, including the tummy, abdomen, glands, bones, and nervous system. So, pulmonary tuberculosis is bacterial infection of the lungs that can cause pulmonary TB. Some of symptoms of the pulmonary TB: chest pain, coughing, and sneezing. So, in pulmonary tuberculosis, first, ma-impact ka to lungs ta. Because in symptoms of the pulmonary tuberculosis, among in sneezing, coughing, and in space. So, in pulmonary tuberculosis, ini ma-impact din in part of the body ta, including the tummy, glands, bone, and nervous system in pulmonary tuberculosis. So, what is a pulmonary tuberculosis? Tuberculosis TB is an infectious disease that primarily affects the lungs, parenchyma. So, in pulmonary tuberculosis is a contagious bacteria infection that involve the lungs. It may spread to other organs. Yun na nga, in pulmonary tuberculosis, in first ma-involve ka to yung lungs ta, hanggang ma-spread pa others part of organs ta in pulmonary tuberculosis. And the primary infectious agents and tuberculosis is an acid-fast aerobic growth. The growth slowly and is sensitive ultraviolet light. So Mycobacterium bovis and Mycobacterium avium so have already been associated with the development of the TB infection. So a Mycobacterium bovis is other Mycobacterium that can cause TB disease in a people is most commonly found in cattle and other animals boobies cause of TB disease that can affect the lungs, lymph nodes, and other part of the body. Yun na nga, and most commonly maapektuhan or mahawaan kita. For example, like mga animals, cow, meat, and milk. So incon isab in Mycobacterium avium. A Mycobacterium avium is a group of bacteria related to tuberculosis. These germs are very commonly in food, water, and soil. So a Mycobacterium avium. So, in commonly makawata in Mycobacterium avium ini ang mga pagkaon na bukod sprinkling paghinang pagkaon mga tubig din makawa mo in Mycobacterium avium. And pathology, TB begins when the susceptible person inhale Mycobacterium and become infected. So, in pathology, among tao affected siya ha TB. So, pwede ma-transmit ka to. For like example, mga pagkaon, for example na mga baso, pagkaonan niya, mga tubig, pagkus nakasaw ko. So, pwede ito ma-transmit kayo mo in TB. And mga pagkaon din. So, tuberculosis is highly infectious airborne disease. Mga inhalation, transmission, defense, protection, scaring, in causing of occurring tuberculosis including the following: talking, abisara, sneezing, close contact, coughing, laughing or singing, low immunity, emigration, overcrowding. And in Center for Disease Control and Prevention, recommendation for preventing transmission of the tuberculosis in healthcare setting, early identification and treatment of the person with active TB, prevention of spread infectious droplets, nuclear source control method, and by reduction of microbial contamination of indoor air in civilians for TB transmission. And clinical manifestation, the signs and symptoms of pulmonary TB are insidious, mga low-grade fever, cough, and night sweat. So,
Okay, what's this video?
Tuberculosis, or TB, is one of the oldest and most common infectious diseases. About 1/3 of the world population is believed to be infected with TB. Fortunately, only about 5% of these infections progress to active disease. The other 95% of infected people are said to have a dormant or latent infection. They do not develop any symptoms and do not transmit the disease. Tuberculosis is caused by a rod-shaped bacterium, or a bacillus, called Mycobacterium tuberculosis. An infection is initiated following inhalation of mycobacteria present in aerosol droplets, discharged into the atmosphere by a person with an active infection. The transmission process is very efficient, as these droplets can persist in the atmosphere for several hours and the infectious dose is very low. Less than 10 bacilli are needed to start the infection. Once in the lung, the bacteria meet with the body's first-line defense, the macrophages. The bacteria are ingested by the macrophages, but manage to survive inside. Internalization of the bacilli triggers an inflammatory response that brings other defensive cells to the area. Together, these cells form a mass of tissue, called a granuloma, characteristic of the disease. In its early stage, the granuloma has a core of infected macrophages enclosed by other cells of the immune system. As cellular immunity develops, macrophages loaded with bacteria are killed, resulting in the formation of the caseous center of the granuloma. The bacteria become dormant but may remain alive for decades. This enclosed infection is referred to as latent tuberculosis and may persist throughout a person's life without causing any symptoms. The strength of the body's immune response determines whether an infection is arrested here or progresses to the next stage. In healthy people, the infection may be stopped permanently at this point. The granulomas subsequently heal, leaving small calcified lesions. On the other hand, if the immune system is compromised by immunosuppressive drugs, HIV infections, malnutrition, aging, or other factors, the bacteria can be reactivated, replicate, escape from the granuloma, and spread to other parts of the lungs, causing active pulmonary tuberculosis. This reactivation may occur months or even years after the initial infection. In some cases, the bacteria may also spread to other organs of the body via the lymphatic system or the bloodstream. This widespread form of TB disease, called disseminated TB or miliary TB, occurs most commonly in the very young, the very old, and those with HIV infections. Tuberculosis is generally treatable with antibiotics. Several antibiotics are usually prescribed for many months due to the slow growth rate of the bacteria. It's very important that the patients complete the course of the treatment to prevent development of drug-resistant bacteria and reoccurrence of the disease.
Hi sir, I will discuss about the assessment and diagnostic findings. Okay, the learning objective is the virus, pulmonary infection with regard to cause, clinical manifestation, nursing management, and complication and prevention. My topic is about the assessment and diagnostic findings. When we say the sputum culture is a positive for Mycobacterium tuberculosis in the active stage of the disease. When we say the skin test is a purified protein derivative PPD or old tuberculin OT administered by intradermal injection by Mantox. By intradermal injection is a positive reaction area introduction that 10 ml or greater. Is an injection of antigen indicate past infection and the presence of antibodies but is not necessary indicative of active disease. When we say X-ray, X-ray may show small patchy infiltration of air layer. Is the lesion in the upper lung filled calcium deposit and held primary lesion or fluids of the infusion change, if indicating. If the advances of TB may include the cavitation, scar tissue, and fibrotic areas in the say. After that, CT or MR scan. When we say CT or MRI scan, is the determined degree of the lung damage and may confirm the difficult of diagnostic in the lungs. Poscopy histologic of tissue of culture. A sure inflammation of the altered lung tissue may also be performed obtain sputum and patient unable to produce the indicate specimen. Histologic or tissue culture is including the gastric watching, urine, and cerebrospinal fluids, CSF. Skin biopsy is a positive for the Mycobacterium tuberculosis and may indicate intrapulmonary involvements. When we say the needle biopsy of the lung tissue, look this picture. When we say is the positive to granulomas of TB present of giant cell indicating necrosis. When we say electrocyte look this picture, so one of example is depending on the location and severity of infection. Of hyponatremia caused by abdominal water retention may be found in intention chronic pulmonary TB, which means tuberculosis. When we say the ABGS may be abnormal depending on location, severity, and residual damage of the lung. Okay, let's proceed to medical management. Medical management is a pulmonary tuberculosis is treated the primary with the tuberculosis agent for 6 to 12 months. There are 3 types of drug resistance must be considered when the planning primary resist therapy. First is a primary drug resistant is resistant to one of the first-line active TB agent in the people who have not previous treatment. When we say primary drug resistance, is defined as a drug resistant in the patient who had not received any past any tubercular treatments. It's a resistance that developed the patient who has received prior chemotherapy is defined as acquired the resistance. Drug resistance is a primary drug resistance rather. When we say the second or acquired drug resistance is a resistance to one or more anti-TB agents in a patient undergoing therapy. When we say is defined as those patients who achieve the confirmed objective response CR and PR or prolongs the stable disease SD of the at least 6 months and then have disease progression in the setting of ongoing to treatment. It's a secondary of required drug resistance. Lastly is the multi-drug resistance. When we say is a resistance to 2 agent isoinacid and rifampicin. This is one example of treatment of medication. When we say multi-dose resistance is a when single bacterium is resistant to more than of antibiotic, it is said to be multi-dose resistant. This can occur in 2 distinct ways. A bacterium can have several different resistant genes, it's providing resistance to a particular antibiotics. Okay, let's proceed to pharmacologic therapy. Ito yung ginagamit sa treatment sa TB. Isoinacid, rifampicin, paracetamide, ethambutol. When we say isoinacid, rather, is a bacterial agent that used to prophylax for neuritis and has side effect of peripheral neuritis, hepatic enzyme elevation, hepatitis, and hypersensitivity. Ito yung ginagamit sa isoinacid. Rifampicin naman. When we say rifampicin is a bacterial agent that turns to the urine and other body secretion into orange or red. I-hate natin, nagko-color siya ng red or orange and has common side effect of hepatitis, febrile reaction, purpura, and nausea and vomiting. When we say paracetamide, is a bacterial agent which increase the uric acid and blood and has common side effect of hyperoxemia, hepatotoxicity, and skin rashes, allergies, and GI distress. Ito yung causes sa mga paracetamide. Sa ethambutol naman, is a bacterial agent should be used with the caution with the renal disease. And caution, used to caution with the renal disease and has common side effect optic neuritis and skin rashes. Ito lang yung side effect ng ethambutol, neuritis and skin rashes. Okay? Let's proceed to nursing management including the following. First is the nursing assessment. Nursing assessment is first a complete story. Dapat alaman natin anong story ng pasyente natin. Kung saan niya naman na to or sa mga relative niya ba or sa mga family niya kung meron. Okay, when we say the complete story, is a TB patient loses with the dramatical and show the loss in physical appearance. Ito yung physical examination. Yung complete history naman is a fast and present medical history in the sense with the both of the parent history and relative history. Next, let's proceed to nursing diagnosis. Sa nursing diagnosis naman, ito yung risk infection. When we say that the risk of infection is related to indicate primary defense and lower resistance. Next is ineffective airway clearance. When we say ineffective clearance is related to think, mucus, or bloody secretion. Next is the risk for and far gas exchange. When we say related to decrease and effective lung surface and active tolerance. When we say is related to imbalance between oxygen supply and demands. The lastly is the imbalanced nutrition. When we say imbalanced nutrition, is a less than body requirement related to inability to ingest adequate nutrients. Nursing care plan. Nursing care plan there are 4. First, promote airway clearance and hardicate treatment regimens, promote activity, adequate nutrition, and prevent spread tuberculosis infection. Next is the nursing intervention. When we say intervention, parehas din sa nursing management. Nursing care plan rather. Is promoting air clearance, adherence of the treatment regimen, and promoting activity and educate. When we say the promoting clearance, is the nurse instruct the patient about the correct position of the facilitate drainage and increase the fluids intake, promote systemic dehydration rather. Ito yung ginagawa ng nurse to instruct the patient kung paano gagawin yung ibibigay na instructions sa kanila. Okay? Next is adherence to treatments regimen rather. The nurse should teach the patient that the TB is a communicable disease and taking medication is the most effective means preventing transmission para maiwasan ang pag-transmit sa mga ibang tao. Next is promoting activity and adequate nutrition. When we say is the nurse plan is a progress activity schedule that focus on increasing the activity tolerance in the muscle strength and a nutritional plan that allow for small and frequent meal sa pagkain ng pasyente. Next is preventing spread of tuberculosis infection. When we say the nurse careful instruct the patient about the important hygienic measure including the mouth care, covering the mouth and nose when coughing and sneezing, proper disposal tissue and hand washing to avoid the transmission of TB para hindi mawaan yung mga pasyenteng iba, yung mga tao. Ito yung ginagawa ng nurse to instruct the patient. Next is acid-fast bacillus isolation disposal. The intake of the APB isolation immediately, including the use of private room with negative pressure inhalation surrounding areas and a maximum 6 air chains per hour para maiwasan natin yung pagkakaroon ng transmission ng para hindi tayo maawaan. Yun ang ginagawa ng pasyente. Lastly is the monitor advice effect. Is be alert for adverse effect and medication. Okay? Next is evaluation. Evaluation is the effect the patient outcome include like promote airway clearance, yung sa paghinga nila, yung airway, and other treatment regimen, promote activity, educate nutrition, and prevent spread of tuberculosis infection. Next is documentation guideline. Ito yung ginagawa namin as a nurse. Restart of current antibiotic therapy, Signs and symptoms, infection of process, the patient. Next is breath sound, prescribe and character secretion, and use unnecessary of muscle breathing. And character of the cough, symptoms, and respiratory rate, pulse, unsymmetry, oxygenation saturation, and vital sign. Okay, next let's proceed to watch this video. Okay, start.
Learning medicine is hard work. Osmosis makes it easy. It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today. It's estimated that about 2 billion people worldwide are infected with Mycobacterium tuberculosis, often just shortened to tuberculosis or simply TB. 2 billion is a ton of people, but even though they're infected, that doesn't mean that all these people have symptoms. The vast majority, about 90 to 95%, aren't even aware that they're infected. And this is because usually the immune system can contain it, such that it's not able to multiply. It often remains latent or dormant, as opposed to active, which usually causes symptoms and can be spread to others. If the host's immune system becomes debilitated at some point down the road, like with AIDS or some other illness, or as a person grows older, it can be allowed to reactivate, or basically wake up and become very serious, especially if it spreads throughout the body. Mycobacteria are an interesting bunch. They're slender, rod-shaped, and need oxygen to survive. In other words, they're strict aerobes. They've got an unusually waxy cell wall, which is mainly a result of production of mycolic acid. Because of this waxy cell wall, they're acid-fast, meaning that they can hold on to a dye in spite of being exposed to alcohol, leaving it bright red colored when a Ziehl-Neelsen stain is used. The wall also makes them incredibly hardy, and allows them to resist weak disinfectants and survive on dry surfaces for months at a time. Now, Mycobacterium tuberculosis is usually transmitted via inhalation, which is how they gain entry into the lungs. Now, we breathe in all sorts of virus and bacteria all the time, but we've got defenses that take care of most of them. For one, air that we breathe in is turbulent in the upper airways, and drives most bacteria against mucus, which is then cleared pretty quickly. Ultimately, though, TB can avoid the mucus traps and make its way to the deep airways and alveoli, where we have macrophages that eat up foreign cells, digest, and destroy them. With TB, they recognize foreign proteins on their cell surface and phagocytize them, or essentially package them into a space called a phagosome. With most cases, the macrophage then fuses the phagosome with a lysosome, which has hydrolytic enzymes that can pretty much break down any biochemical molecule. TB is tricky though, and once inside the macrophage, they produce a protein that inhibits this fusion, which allows the mycobacterium to survive. It doesn't just survive though, it proliferates and creates a localized infection. At this point, somebody has developed primary tuberculosis, which means that they have signs of infection soon after being exposed to TB. Even though it sounds bad, most people at this stage are actually asymptomatic, or maybe have a mild flu-like illness. About 3 weeks after initial infection, cell-mediated immunity kicks in, and immune cells surround the site of TB infection, creating a granuloma, essentially an attempt to wall off the bacteria and prevent it from spreading. The tissue inside the middle dies as a result, a process referred to as caseous necrosis, which means cheese-like necrosis, since the dead tissue is soft, white, and looks kind of like cheese. This area is known as a gone focus. TB also gets to hilar lymph nodes, either carried over by immune cells through the lymph or by direct extension of the gone focus infection, and causes caseation there as well. And together, this caseating tissue and associated lymph node make up the characteristic gone complex. Gone complexes are usually subpleural and occur in the lower lobes of the lungs. The tissue that's encapsulated by the granuloma undergoes fibrosis and often calcification, producing scar tissue that can be seen on X-ray. This calcified gone complex is called a Ranke complex. In some cases, although a scar is left over, the mycobacteria is killed off by the immune system, and that's the end of that. In other cases, even though they're walled off, they remain viable, and are therefore still alive, but they're just dormant. If and when a person's immune system becomes compromised, like with AIDS or with aging, the GON focus can become reactivated, and the infection can spread to either one or both upper lobes of the lungs. It's thought that this is because oxygenation is greatest in these areas, and TB, being anaerobe, prefers areas of greater oxygenation. Since they were previously exposed, the immune system's memory T cells quickly release cytokines to try and control the new outbreak, which forms more areas of caseous necrosis. This time, though, it tends to cavitate, or form cavities, which can allow the bacteria to disseminate, or spread through airways and lymphatic channels to other parts of the lungs, which can cause bronchopneumonia. But it can also spread via the vascular system, and infect almost every other tissue in the body, called systemic miliary TB. When TB spreads to other tissues, it causes complications related to the organ affected. Kidneys are commonly affected, resulting in sterile pyuria, or high levels of white blood cells in the urine. It might also spread to the meninges of the brain, causing meningitis, the lumbar vertebrae, causing Pott disease, the adrenal glands causing Addison's disease, the liver causing hepatitis, and the cervical lymph nodes causing lymphadenitis in the neck, also known as scrofula. Testing for TB often starts with a purified protein derivative, or PPD intradermal skin test, sometimes known as a tuberculin skin test, MAN2 test, or simply TB test. With this test, tuberculin is injected between layers of the dermis. Tuberculin is a component of the bacteria, and if a person has previously been exposed to TB, the immune system reacts to the tuberculin and produces a small, localized reaction within 48 to 72 hours. If the reaction creates a large enough area of induration, rather than just redness, it's considered to be a positive test. Positive tuberculin tests simply mean that the patient's been exposed at some point to TB. It does not differentiate between active and latent disease. As an alternative to tuberculin skin tests, there are also interferon gamma release assays, or IGRAs, which look for evidence in the blood of previous exposure to TB proteins. Since this one's a blood test, you do not need to show up again to have the test read like you do with a PPD. Also, the IGRA is more specific to TB rather than other types of mycobacterial infections, and is unlikely to be positive as a result of having BCG vaccine in the past, a vaccine that protects against TB. And this is a pretty useful feature of IGRAs, since BCG vaccine is given to many children around the world to prevent disseminated TB. After doing a screen test with PPD or IGRA, anyone with a positive result typically gets a chest x-ray to look for signs of active TB disease. In patients with symptoms like fevers, night sweats, weight loss, and coughing up blood, or hemoptysis, it's important to collect samples from either the sputum or via a bronchoalveolar lavage, which is where the bronchoscope is inserted through the mouth or nose into the lungs. Fluid is squirted, and then the fluid is collected. These samples can get sent to the lab for staining, culture, and PCR to look for evidence of Mycobacterium tuberculosis. Treatment of latent TB infection typically involves using a single drug for a prolonged period of time. The most common approach is isoniazid for 9 months. Treatment of active TB disease is typically done with different combinations of anti-TB antibiotics like isoniazid, rifampin, ethambutol, and pyrazinamide, which results in patients being non-infectious to others usually within a few weeks. Until that point, though, patients can spread TB to others, and it's typically adults with reactivated TB that are the most infectious. As a result, patients are typically kept in negative pressure rooms, and visitors are asked to wear protective N95 masks that can't filter out oil aerosols, N for not resistant to oil, but can filter out at least 95% of other aerosols, in this case TB. Even after patients are no longer contagious, they're typically kept on multiple medications for many months to be sure the bacteria are destroyed, usually with direct observed therapy, or DOT, where somebody watches and confirms that you're taking the medication. Additionally, there's an enormous worry about new drug-resistant strains of TB that are causing infections in various parts of the world. You might hear of MDR-TB, or multi-drug-resistant TB, or even XDR-TB, which is extremely drug-resistant TB, which is incredibly hard to treat because they don't die in the presence of our usual antibiotics. The bottom line is to get an effective treatment. It's super important to make sure that the drugs being used will work against the specific strain of TB, that multiple medications are used together to prevent drug resistance from developing, and that medications are used for the entire course of therapy so that all of the Mycobacterium tuberculosis is killed off. Recently, the US Food and Drug Administration has approved a breakthrough medication for XDR-TB called pretomanid. According to recent studies, a combination of pretomanid, bedaquiline, and linezolid has been effective for almost 90% of XDR-TB cases. As an added bonus, this combination therapy can be taken orally and is also very well tolerated compared with other XDR-TB drug regimens. Alright, as a quick recap, tuberculosis, or TB, is an infection caused by Mycobacterium tuberculosis that mainly affects the lungs. 3 weeks after the primary infection, the immune system tries to contain the infection created by a granuloma, and the tissue in the middle undergoes caseous necrosis, resulting in an area called a gone focus. TB also extends to nearby hilar lymph nodes, causing caseous necrosis there as well. The gone focus plus the affected lymph node makes up the characteristic gone complex. If the immune system becomes compromised, like with AIDS or older age, the gone focus can reactivate, and the infection can spread to one or both upper lobes of the lungs, where it forms cavities. From cavities, bacteria can disseminate to other parts of the lungs, causing bronchopneumonia, but it can also spread through the vascular system and infect almost every tissue in the body, which is called systemic miliary TB. Testing for TB starts with a PPD intradermal skin test, or with an IgRA blood test, and a chest x-ray can identify signs of active TB disease. In patients with fevers, night sweats, weight loss, and hemoptysis, a sputum sample can be stained, cultured, and PCR can be done to look for Mycobacterium tuberculosis. Treatment of active TB includes a combination of antibiotics, given for several months, and special regimens are used for MDR-TB and XDR-TB. Thanks for watching. If you're interested in a deeper dive on this topic,
Okay, that's all. Thank you.